Okay, I want to just follow up with the pulse rate and some other factors to consider. One of the things that I think is important to consider is that you don't always have to take a 60-second pulse rate. You actually could take a 30-second pulse rate and then multiply that number by 2, which would give you your 60. But it's important to remember that we don't recommend that, and some facilities have policies against a 30-second pulse rate, especially if a patient has an irregular heart rate. So if the patient's heart rate is irregular, so it's not in a regular rhythm, it slows down, speeds up, slows down, maybe it skips some beats. In those cases, they want you to absolutely do a 60-second pulse rate. Some facilities will even say do a 2-minute pulse rate and then divide that by 1, so that you get your 60-second, and it gives you a better accurate reading. Some people have asked me if they can do a 15-second pulse rate, 15 seconds on the clock, count those number of pulses, and then multiply by 4. I don't think that's a good idea, especially when you're new, because your numbers could be off, and if they're off, then you're not providing a very accurate number to the provider. So in our class, I think the best thing to do is a 30-second, again, if the heart rhythm is regular, or a 60-second. 60 seconds will always give you the most accurate reading. Oftentimes we combine, we validate, we double check your number. So if your number is off because you did a 15 and multiplied by 4, and I do a 60 and we're off, then we're probably going to have you repeat that. So be really careful. Another thing I want to mention to you is that a pulse rate can be detected in different parts of the body. I just showed you where the radial pulse is, but we also have a brachial pulse, which is right here at above the bend of the elbow. And then there's the carotids on either side of the neck. And there are some down the leg, the femoral and the pedal pulse. So there are other options. If you can't find a pulse on one wrist, instinctively just go to the other wrist. You might find better circulation on that side. If both wrists have very poor circulation, which that could be, then maybe try either side of the brachials. So these are the pulse rates that you feel in the arm. So it'll be on the inside of the arm, not the outside, but the inside closer to your body. So you have to take time to find that. Those are a little bit deeper, so you really have to press a little bit harder.
So if people were to have a very irregular heartbeat, and say we did it for 2 minutes, we would take that number that we received and divide it in half. Is
Yes,
that correct?
That's correct.
All right.
Thank you.